Welcome to Fresh Start. Are you ready for health? We've been talking about fine-tuning. A common question that I get is, should I take supplements? My answer is, it depends. It depends on what you're eating and what your doctor says. Generally speaking, if you're eating this plant-based whole food diet, you won't need much in the way of supplementation. When I recommend a plant-based whole food diet, people often ask, well, what about my protein? What about my calcium if I don't consume dairy? Well, you only need really about 5 to 10% of your calories coming from protein. Most Americans eat way more protein than they need, and it's mostly animal-based protein, which is packaged with cholesterol and saturated fat that causes damage to our hearts. Eating those high-protein diets that are animal-based also increase our risk of cancer. So where will you get your protein? Well, beans have about 25% protein. Broccoli has about 26%. You'll get all the protein you need without even thinking about it if you eat the broad-spectrum plant-based whole food diet that we're encouraging you to do. Oh, what about the calcium? Don't you need dairy? And the answer is the same. No, you don't. You'll get all the calcium you need from beans and greens. Well, what about vitamin D and omega-3 fatty acids and multivitamins? We hear lots about those. First, for multivitamins, you probably don't need those if you're eating a plant-based whole food diet. The same goes for those omega-3 fatty acids. The omega-3 fatty acids function by helping offset the omega-6 fatty acids, which are high in the animal-based products. However, if you're eating a plant-based whole food diet, you have very low levels of omega-6 fatty acids and therefore don't need much omega-3 fatty acids. You'll get probably all you need in the food that you eat. Well, vitamin D is a bit tricky. Studies are coming out showing that taking vitamin D when you already have established disease doesn't seem to help reverse the disease. However, other studies show that deficiencies in vitamin D are associated with many of the chronic diseases like diabetes and heart disease. These studies, however, may really be pointing to a common cause. The low vitamin D levels may be coming from the same things that are causing the diabetes and heart disease, rather than one causing the other. Until this is sorted out, Dr. Greger at nutritionfacts.org has some recommendations that I think make sense. If it's a time of year and a climate where you can get good sunshine, try to get about 15 to 30 minutes of sunshine a day. If you're not able to, or if it's the winter, then 2,000 units of vitamin D a day may be helpful. 3,000 units if you're overweight. When you look for a supplement, D3 is better than D2, and it helps the absorption if you take it with the largest meal. There's some other specific supplements we'd like to just mention. Vitamin B12 in particular. If you're over age 50, or you're eating a completely plant-based diet, or you have an absorption problem in your intestinal tract, you may want to be taking B12 on a regular basis. Vitamin B12 is essential for health. It helps in blood cell formation, it helps with your neurologic system, and in your gastrointestinal tract. Vitamin B12 is produced by bacteria. We get it in our animal products for contamination in food. Our ancestors used to get it from the water supply or the soil. The body has a long-term supply of vitamin B12 in our livers. It takes over a year for a deficiency to develop if you're not taking vitamin B12. So vitamin B12 is especially important for those who eat a completely plant-based diet, those who've had bariatric surgery or other surgery on their small intestine, people with Crohn's disease, other things where they have poor absorption, and for people who are 50 plus years old. It's best to get a pure supplement of cyanocobalamin rather than a multivitamin with vitamin B12 in it. Adults should take about 50 micrograms a day or 2,000 micrograms weekly. That math seems a bit confusing, but it's because absorption is limited with larger doses. But for some people, it's easier to take a once-a-week dose. If you're over 65, 1,000 micrograms a day is recommended by Dr. Greger. If you have an absorption problem, a sublingual form is best. Turmeric is another interesting supplement. If you look in PubMed, where the medical literature is, there are thousands of studies published on turmeric, and the number continues to be added to regularly. Turmeric has some interesting anti-inflammatory effects. It's helpful in treatment of autoimmune diseases like Crohn's disease and rheumatoid arthritis. It's helpful in pain management. It's actually equivalent to a low-dose statin. in lowering the cholesterol levels in the body without the side effects that a statin can cause. Turmeric also helps stabilize blood sugar. Although the dose varies in the studies that are published, recommendations are in the range of about 1,500 milligrams per day. That's 2 to 3 capsules depending on the size of the capsule. Ideally, take this with food because it's absorbed better. And if you add black pepper to the food that you're eating, it helps keep turmeric in your bloodstream longer. Flaxseed's another interesting supplement. It's shown to be helpful with things like cholesterol, triglycerides, blood sugar, blood pressure, constipation, cancer, and inflammation. In the left sidebar, you can download an information sheet on flaxseed, as well as many of the other supplements we're talking about. And I'd encourage you to consider going to nutritionfacts.org and looking at the various resources they have on these different supplements. Flaxseed does provide some of those omega-3 fatty acids that we've already talked about. To get the therapeutic benefits from flaxseed, such as helping with blood pressure, it's recommended that you have 2 to 4 tablespoons a day. This can be added to a salad, mixed in with your oatmeal, or added into other foods that you're preparing. You want to use ground flaxseed. The whole flaxseed oftentimes will pass through your system without any absorption of those omega-3 fatty acids. Once you grind it, you want to keep it cool because those acids that are then exposed to air can go rancid over time. Ginger is another interesting supplement. It's been shown to have some benefits in treating nausea, motion sickness, migraines, headaches, and pain. It's something you can easily add to your oatmeal and other foods for flavoring. You can buy capsules to take, augment the effects of things like acetaminophen for a headache. And cinnamon is also an interesting spice that not only helps make your oatmeal taste better, it might help with your blood sugar control. It is an antioxidant as well. There are 2 types of cinnamon that are marketed. One is called cassia or Chinese cinnamon, and the other is Ceylon cinnamon. It's the cassia or Chinese cinnamon that is most effective. However, you don't want to take too much of it because it has a side effect of acting like a blood thinner. So you probably want to limit that to no more than a half teaspoon a day. Generally, however, other than vitamin B12 and possibly vitamin D, you don't need any of these supplements if you're eating a plant-based whole food diet. There might be special cases where they would be beneficial to you. We'd encourage you to discuss those with your primary care provider. So what's the dosage of that plant-based whole food diet? We want you to be eating about 40 grams of fiber a day or more, at least 75% of that plate filled with those foods rich in fiber and water, and a cup of beans a day. We encourage you to minimize those animal products and processed foods. Avoid eating those large meals and snacks in the evening, especially late. Try to fast for at least 12 hours during the night. You can exercise before breakfast after that fast, and then again during the day after your meals to help bring down your blood sugar. If you like to walk, we'd encourage you to get a pedometer and work up to 10,000 steps a day and more. To keep that weight under control, we want to be working toward 30 minutes a day of vigorous exercise or 60 minutes a day of moderate exercise. So now it's time to write your goals. You can find a goal sheet to print on the left sidebar. We encourage you to pick some of these goals that make sense to you. Are you ready for health?